Let me bring in Andy Slavin, former acting administrator for the Centers for Medicare and Medicaid Services in the Obama administration, Dr. Amir Aldin, an ER doctor and chief medical officer of U.S. Acute Care Solutions, and Dr. Alexander Garza, chief medical officer of SSM Health. He helped lead the nation's response to the H1N1 virus in 2009. He was then the chief medical officer with the Department of Homeland Security. I'm glad to see all of you, but I want to start, Andy, if I can, with you and this breaking news about the problems on board this ship. Obviously, folks there in very close quarters, enough concern that the captain of the ship wrote a letter and said that, as I quoted, sailors do not need to die. Talk about the particular problems that would be involved when you have a situation like this, where you have dozens of people now who are on board who are sick.
We should be thinking right now in terms of limiting the scale and scope of the tragedy. Whether it's this ship or anybody who's watching this program that lives in close quarters, we've got people in nursing homes, prisons, people who live in multi-generational households, with their parents or grandparents. Those are situations that are normally not dangerous. Today, they represent the potential for tragedy. The things that will drive up the death counts that are on the right-hand side of everybody's screen right now are a couple of things, but one of them is preventing the older and sicker populations and people in close quarters from being exposed to this. The Navy does not want that to happen, and I'm quite sure they have the operational capacity to make sure people are isolated and quarantined. But I think there are other parts of the country where you've got the exact same things going on, but because of the lack of testing, we don't know whether there's confirmed cases, and therefore you've got dangerous situations. So please take a special care right now to make sure that we take care of these populations, isolate them as best as possible. This won't go on forever, but it's critical right now.
There has been, Dr. Garza, such a disconnect from state to state, sometimes even from county to county, about how we're dealing with these situations. Governor Ralph Northam, for example, in Virginia, put his state under a stay-at-home order for 70 days. That is later than many states, but longer than many states. Is Governor Northam, do you think, giving his state in one shocking announcement essentially what most other states and much of the country will actually end up doing anyway? Talk about this, if you will.
Yeah, so we're finding out more and more every day. And so I think we need to think about this as a phased approach. So when the outbreaks were first occurring in the U.S., of course, many of the local leaders did start taking those dramatic social distancing, social isolation matters, and they would chunk it out, though, and say, okay, we're going to do this for 30 days until we learn more, maybe 60 days. I think the benefit of starting later, like the governor did in Virginia, is there's more information that's coming about, and so you feel more comfortable with making some of those very dramatic announcements for longer periods of time. I think the more that we learn, the more that the other counties, states, other jurisdictions are going to start pushing that time limit out as well. We're getting more information back on our modeling, on the disease spread, and I think it'll just be a matter of time.
Dr. Aldin, what is your message to other states? I'm thinking, for example, about Florida. More than 5,700 cases confirmed, but they're way behind in testing, so I guess we don't really know. Spring breakers have been there. They've left, gone all over the country. How problematic do you see it that Florida hasn't put a stay-at-home order in place, where 1 in 5 residents, I think the number is over 65?
Look, I think it's important to maintain the social distancing. I couldn't comment specifically on why Florida has chosen not to do that at this point. There is a little bit of population density that comes into play here, and we've seen the east coast of Florida being more affected than the west coast. I agree with the reasonableness of the strategy of the governor from Virginia. I think 70 days is actually quite reasonable. And I'm hopeful that other states will follow that in the light of proper data.
So let me talk to you, if I can, Dr. Aldin, about the question of supplies. And there seems to be, again, another disconnect between some official reports about where we are on supplies and hospitals themselves. You also now have a question about whether or not masks should be worn by the general public. What are you hearing? What are you experiencing in terms of supplies, first of all? And then I want to ask you about this idea that the way to help hospitals not have so many people coming in may be for the everyday American to wear a mask when they go out.
It's a great question. On the supplies issue, yes, we are short on supplies still. Hospitals are scrambling to get the supply in. The N95 masks are the most valuable in this regard. Certainly the other masks, the surgical masks as well as cloth masks are helpful, but more as protectors around the N95s. So we definitely still have shortages. We need those supply chains to open. Our physicians, our PAs, our NPs report to me on these shortages. So they are very, very important to understand that these are still going on right now. On the general public side, masks, I sort of agree with the Surgeon General. Masks for the general public might be helpful in certain regards, but in other cases, they'll give you a false sense of security. You do tend to touch your face more when you have the mask. And what we don't want is for people to wear masks and then view that as armor to just go out and not practice proper social distancing. So I don't agree that the general public should take masks, use them, and then think that they're somehow protected.
We did hear about social distancing again, as we have every day, Andy, from Governor Cuomo, and you can sense his frustration. He said, I know it's hard to stay at home. I know everyone thinks they can go out and I can be smart. That is not true. What do we know about the impact of social distancing so far, and put it in the context of the decisions that these governors are making, Andy?
Great. Well, in Seattle, which had the scare of their lives there, losing all those people in the nursing home, seeing the early deaths, the fact that they acted quickly, they have reduced their infection rate from over 2 to something like 1.5, getting closer to where Wuhan was. In the liberal democracy, that's very hard to do. And we know that that requires sacrifice. But if you look back, actually, instructively, the National Geographic ran a look at the 1918 flu epidemic and how about 20 different cities reacted in terms of when they implemented social distancing standards and how long they kept them on. And the story is really compelling because those that started even a week or two earlier and who sustained it for several weeks longer had about half of the death rate per population than cities that started even a week later or came off a little too early. So we should be prepared, as I think the governor in Virginia has done, for a period of time that will allow this transmission rate to drop dramatically, that will also give our frontline medical workers a chance to take care of people when they come in, and it'll give our scientists a chance to develop therapies and tests that are so lacking that the doctors have just referred to.
Dr. Garza, what do you see as the priorities right now? I think all of us were struck hearing Governor Cuomo say, he said, look, everybody wants to know, when is the apex going to happen? When is this going to be over? And he said they literally have 5 different models that show between 7 and 21 days, which just shows you, both what we do know and how much we don't know. What do you see as the priorities right now? In some cases, the horse is out of the barn. If states did not, up until this point, make a decision that they were going to shelter in place, individuals who have decided that they're not going to do it. But what are the things you see that we need to prioritize right now, knowing that this isn't going away tomorrow, next week, and maybe even not next month?
Yeah, so it's a sort of a delicate question. One is on the public policy side and one is on the medical care side. So on the public policy side, we absolutely need to be doing the social distancing for extended periods of time. On the medical care side, I think it's a much more dramatic. We are running through our personal protective equipment really rapidly. And so if you think about what are the needs right now, what are the priorities, It's personal protective equipment for healthcare workers, increasing ICU capacity, and then ventilators to take care of patients. For the longer play, we need more testing. And that's the only way that you can impact that down the road, is to start separating those people that are infected from those that are not infected, because the goal is to decrease transmission. So there's multiple different things. But if you're saying the immediate target is PPE, ICU, ventilators, the longer play is testing and isolation public policy.
Dr. Alexander Garza, Andy Slevitt, Dr. Amr Al-Din, couldn't have a better group of experts to get us through what has been another day of revelations. We thank you so much for your time and your expertise.